I saw a guy just this week that hadn't been to the physician in 2 years, and I started seeing him, and now his wife, they're not keeping chips. He's got her changing her shopping habits, and I've only seen him a couple times. And, you know, all of a sudden now his children have a healthier future potentially by changing their habits at home. So those are just the things that drive me just.
We don't require anybody to do anything, but we want to provide incentives for them to do the right thing. And by the same token, there has to be a strong enough disincentive to where finally we're not hitting them over the head. They maybe get some pretty subtle hints, because ultimately the only thing we want is for them to do things that are going to improve their health.
The main thing is the one-on-one contact with the pharmacist that comes in and helps me to go check my contents of food I'm eating, give me some better ideas on ways to eat better snacking, and just an overall check for myself has been good. It keeps me disciplined.
Even, if you provide all the knowledge, if, they don't have some sort of accountability and regular follow-up, people tend to, lose interest, get a little slack, whereas we're seeing people 6 to 8 times throughout the year, much more frequently than even just their doctor's visits. Each time I see a patient, I go through the list of the goals they set from last time and see where they're at in achieving those goals. So right off the bat, they're held accountable, and I think that's one of the things that makes the program successful.
I believe when we went through enrollment, we got over 90% of the people who were eligible. From a company standpoint, over the first 6 months, we've saved them about $300,000, thereabouts, depending on, where you look at. So they were very excited, and that was very well received.
I was shocked how many people hadn't seen their physician in 2, 3, 4 years, didn't have lab work, had no idea where they were. We've got people on therapy that is appropriate for them. We had several people lose 30 pounds or more on the program just by talking to somebody and realizing that they can eat. They just have to pick the right things.
They just feel more confident about their knowledge and abilities on how to handle that. They're actually using the blood sugar readings as kind of a tool to kind of help them make educated lifestyle choices.
So my A1Cs when I started this program were 10, 11s, and currently my A1C is running about a 7.4, which is tremendous, and makes me feel really good that I've been able to reduce that.
I think they're a great addition to the staff here, and that has really become a lot more seamless. And I think that they've been able to kind of serve as, the hub for things medication related. So they've been able to interface with community-based providers, and I think probably gotten more positive results and less pushback, because sometimes the clinicians here are seen as competition to the community-based providers.
I think one of the things the pharmacist does do a good job in playing the role of is really sort of looking at the patient as an individual and working with them. I think kind of we have a different perspective than maybe physicians have. So I think they take on a lot of sort of community health role. Even my staff pharmacists at our store, I think I've see them, becoming sort of that advocate for the patient at times, just because they see the patient more than maybe some other members of the healthcare team.
Seeing patients walk away happy that they've been helped, no longer frustrated, having access to things that they may not have had access to before, whether that be knowledge, medication, and empowerment that they can do it, whatever that is just a good feeling.